All right, in this video, we're talking about tibialis anterior. It's a really common shin issue, and I'm here with Samantha, who's got a tibialis anterior issue. So follow along right to the end. I'll explain what it is, how it presents, and then most importantly, how we're going to fix it. All right, guys, I'm Andrew Wine, foot and ankle physio, and I'm here with this real-life patient who's having an issue, not at the top end of tibialis anterior, but at the bottom end down at her foot. And we usually know about shin issues with tibialis anterior because this muscle, or tibant for short, is up here in the shin area here. So it just comes off the tibia here. And if I poke around in here, so Sam's flinching there because that's really, really tight, especially when we compare to the other side. So if you lift your ankles up like so, good, we can actually see that muscle pop up. Just pull up as hard as you can. Yeah, good. So we can see that muscle really jump up here. All right, that's tibialis anterior there. It comes down, and if you relax that foot, we can see the tendon comes down and inserts down here. So with shin splints or anterior tibial issues up here in, say, for example, runners, that's a common issue. The muscle gets overloaded up at this top end and we get shin pain, whereas with this issue, it's the same muscle, but it's down here at the tendon insertion, down here into the foot. And if we zoom in here, you should be able to see which side is symptomatic because there's a little bit of swelling just around the tibialis anterior insertion here. Okay. Now, like all things, it's really important that you rule out other differential diagnoses like a bone stress injury or other things. So if in doubt, make sure you see your health care expert who can rule out those other diagnoses. So really what we're dealing with here is tibialis anterior insertional tendinopathy. Huge words, but essentially it's what we used to call tendinitis down here. And you can see that it is definitely inflamed. All right, there's a few tests I'm going to take you through now. This will be interesting to go through. So the first one is, let's just test the strength of pulling up like that. So if you hold up towards there, great. Good, so that's nice and strong. We can see that tendon and that's not painful? No, great. All right, so let's just bias that a little bit more. Pull up and turn in. Good. So this is what tibialis anterior does. It dorsiflexes and inverts the foot. Hold it there. Okay, so that's still strong. That muscle is still strong. Did that hurt? Nothing? Okay. If we now put it into a more tendon compressive position, which is out here. Okay, now the tendon's wrapping around the corner here now. Now pull in there. Okay, so that's a bit harder. And is that a bit sore? A little bit, yeah. So that's starting to reproduce Sam's pain there. Let's compare to the other side. So pull up. We put the foot into a pronated position. Now pull in. And she's a lot stronger and there's no soreness at all there. Okay, so we've got our diagnosis there. Now we're going to really have a look at how we're going to solve this issue. So importantly, the first thing we're going to do in just a second is massage and release some tension in here and loosen off, and that'll make an immediate difference. Second thing is we're going to deload this tendon because we've got to look at why this happened in the first place. And just going back through Sam's history, she went on a really, really long walk in not so supportive shoes. So we didn't have that arch support, overloaded that tendon, and now it's struggling to settle down. But there's something else that's really interesting that I want to show you here. Tibialis anterior is on the front, hence the name anterior. On the back of the tibia, we've got tibialis posterior. Let's have a look at how well that's functioning. So the two of them work together in tandem. So to get tibialis posterior, we point down and we invert, and we can see that tendon in there. If we're getting closer there, I'll be able to show you that. So here's tibialis anterior, here's tibialis posterior, just see that tendon there. So watch what happens here. Push in hard against me there. Okay, now I can easily overpower her there. And this one here, to compare, point down, turn in, and hold. I cannot, no matter how hard I try, overpower that one. And it needs to be like that because tibialis posterior has got to deal with body weight. And if we're running or walking fast or going down hills, that body weight is multiplied, potentially if you're running even up to 5 or 7 times in some cases. So it's got to be really strong to deal with that force. So now the picture gets a little clearer. tibialis posterior is not really strong enough. So we're going to need to strengthen that one. And tibialis anterior is overloaded. It's nice and strong, but it's having to do the job for two muscles. So what we're going to do today is loosen off that tight muscle through here, take some tension down. We're then going to strengthen tibialis posterior, and we'll do all that with a very careful reloading or load management strategy where we don't overload it with long walks. We're also going to look at supportive shoes as well and gradually get this foot and ankle stronger again. Now, really important, you want to stay away from massaging anywhere near that swollen spot. Grumpy tendons like that do not like to be directly rubbed. We want to take tension off up at this top end. So we can use our thumbs through there, and personally, I like working from top to bottom to try to create some tension or relieve tension, I should say. Create some space down around that bottom end. So I'm going to use my elbow through there. And that's going to be a little bit uncomfortable. I'll just take out a little bit of tension there. So some other good techniques for a muscle that's overloaded and is in a bit of spasm is dry needling with acupuncture needles. Sometimes we use trigger point therapy as well. That's where we find the knots or trigger points in the shin muscle like that, and that's quite sore, and we hold sustained pressure on there, often up to 60 seconds. Until that muscle releases. Good, just starting to let go now a little bit, so that's quite stubborn. So there's a clue there that this has been holding on for quite some time. Great. Once that releases, we move down to the next spot. It's not quite as tight there. Good, and we can feel that letting go as well. All right, a few more passes down through here. And it's not so much about how long you might treat this area for, but it's about effectiveness. So we really want to feel the tension coming out of that muscle. So we restore some normal length tension relationship on that muscle and take some pressure off that poor tendon that's grumpy down there. For the actual swollen area down here, it's worthwhile considering some ice and some topical anti-inflammatory gels if you have them available, and if that's safe to do so. So check with your doctor or pharmacist before doing so. But topical anti-inflammatory gel on an area like that's close to the surface can be really helpful for settling it down, and ice as well. 5 to 10 minutes with ice directly on the area, or gentle ice massage is a good idea as well. All right, good. So that has softened quite nicely there. Let's retest that movement that was a bit painful before. So we were dorsiflex and we were everted, and we're pulling hard. How's that feel now? A little bit less painful. Okay, great. So just by taking off some tension down here, actually to me, it actually feels stronger. So that muscle's starting to work a little more effectively and is less painful. Of course, that's not going to solve the underlying mechanical issue that we identified. And so in order to address that, we're going to strengthen tibialis posterior as something that this patient's going to do at home. So now we're going to address the underlying mechanical insufficiency that really led to the overload. So if we have a look down here, in this position here, we've got the leg crossed, we've got a resistance band, and it's a light to moderate resistance band. And we don't really want to put this anywhere near the tibialis anterior insertion here. So it's really important that we place this band below that. And if we invert in that position, you can see this is emphasizing tib-ant. We actually don't want that in this case. We're going to plantar flex the foot, great, and now invert, so lifting up towards there. Good, and just hold there. Is that sore? Perfect. We want this to be pain-free. So you can see tibialis anterior is still working, but it's not the dominant muscle. Now we've got, because we're plantar flex, we've got tibialis posterior working. We're going to lift up as high as we possibly can. We're going to work in that inner range. And we're going to do a hold. We're going to do a 30-second hold. 4 sets of 30-second holds. You can see that tendon working really hard. Oops, and that sometimes happens. So getting this band in the exact right spot is really, really important, and it's got to be anchored well around the other foot, like so. Great, onto the ground. So again, we just lost that position. So holding, we call this an isometric hold. This is just stage 1. This is not going to get it strong enough to high performance, but we'll do that in stage 2 and 3 in coming weeks. We just have to do this in small stages and chunks. So this is a daily exercise, 4 sets, 30-second hold in that plantar flex inverted position. That's really important. Okay. So there you have it. That's tibialis anterior. That's what you might see when you see an issue down at the tendon at the bottom end. And stay tuned in part 2. We'll follow this case along in 2-3 weeks after we've strengthened up that tibialis posterior, and we'll take it to the next level. But if you like this content and there's something else that you'd like some help with, pop your request in the comments below and we'll film some content on it. Thanks for watching, and make sure you subscribe so you don't miss out on any other videos that are also like this.